Thank you. Well, I have some good news from Washington, D.C. on a beautiful Washington day. And that news is amidst all of the noise that we hear from the nation's capital. In fact, last Thursday night at about midnight, we struck a great step forward where the kind of health care that we have in the state of Washington can now become the kind of health care the nation will enjoy. Because we believe here in Washington that we need value in health care, not volume in health care. And we believe in high quality health care here in Washington, not just volume of health care that many places in the nation are in fact experiencing. So I'm here to announce that last Thursday I was appointed by Speaker Pelosi to work with the team in the House to develop a negotiated settlement of two major issues that have prevented the kind of things we do here in Washington from becoming the practice in healthcare nationwide. Let me start with the most important thing we do here in the state of Washington. We at Children's Orthopedic Hospital, at Group Health, in Everett, in Virginia Mason, other places, have figured out the ways to develop high quality care at reasonable costs. Other places across the country have not figured that out. Now, let me tell you how glaring this disparity is. Here in the state of Washington, Medicare spends $7,200 per patient per year. In Miami, Florida, that figure is $16,300, more than twice the cost that Uncle Sam contributes for health care in Florida than the state of Washington. We now, as part of the agreement we struck last Thursday, in this health reform bill, will in fact bring to the rest of the country the high value, high quality, reasonably priced health care that we are delivering right here at Children's Orthopedic Hospital. And it's doing this in two ways. First, we are making a major improvement in how health care is delivered. We have a system right now in many places in the country. I mentioned Miami. It's not the only place that experiences these high costs. But in fact, excuse me a second here. We haven't cured the frog in the throat syndrome. In many places of the country, they have not developed the high quality procedures that we have here, right here in Seattle. As a result, what we have basically is a pay-for-service model has led for overutilization. In fact, in other places of the country, they might do twice as many surgeries, twice as many MRIs with no better health quality. We have found ways to cooperate where physicians talk with one another, where physicians share information, where physicians share their results of their experience. And this has resulted in high quality medicine at a lower price. So what we did last Thursday is we reached an agreement that the Institute of Health will do a study over the next 2 years, and the Secretary of Health and Human Services will present a plan that will go into implementation to bring high quality medicine at a reasonable price to America, not just Washington, unless the Congress effectively overrides that decision. When we do this, the kind of things that are happening right here at Children's Hospital are going to produce value, not volume, in the rest of the country. And that is the Washington way. We are bringing Washington's way of healthcare to the United States. Now that's the first thing we're going to do. The second thing we're going to do is a second Institute of Medicine study that will essentially study the huge economic disparity of the reimbursement rates that we now suffer from. For decades, we have had this Gordian knot we have not been able to break, which is that in places across the country, like New York and Miami, physicians are reimbursed 15% more, and hospitals are reimbursed more than they are for doing the same procedure. And it doesn't make sense, frankly, that physicians and hospitals have to deny care sometimes to people in Washington State because they're not being compensated adequately. So we are calling for the Institute of Health. We'll do a study that will go into effect at the conclusion of that study to repair these economic disparities in a way that truly depends upon the cost and the evidence that the medical community can generate. So the good news from the nation's capital is this. the things that we have built, developed in Washington State, we have a lot to be proud of. We developed the kidney dialysis machine here. We're doing huge cancer research improvements right here in Seattle, Washington. And now we're going to bring to the rest of the country the value, not volume-based systems of reimbursing doctors and hospitals that will help us increase health and increase the health of the fiscal condition of Uncle Sam. And that is a major step forward. This doesn't mean that this bill is ready to take out of the oven yet. We are still working to find a consensus in this bill, both in the House and the Senate. You may have heard some significant discussion even in the Democratic caucus about this, about the cost of this bill. And what we are finding as we go forward is that we have to develop ways to move to this value, not volume process. And the way we have proposed it, I believe, will achieve that. Some folks have heard of the Congressional Budget Office, some criticisms of this bill. Those criticisms do not pertain to the proposal we reached last Thursday night. CBO hasn't heard about those proposals yet. So we are very happy about what's going on in the last week. I want to just close by thanking Children's and Group Health for their incredible work. One of the reasons I am so intent on achieving success here is I spent a couple hours at Children's a few months ago looking at their infection control systems, where they have achieved significant reductions in infections because they've brought this value-based system on how they practice in the hospital setting. We need to make sure hospitals around the country do that. One of the reasons I'm excited about Group Health being there is I've been in the Group Health family now almost my whole life. My mother and father have had great health care from Group Health, and they've been able to do it at reasonable prices relative to the Miamis and New Yorks of the world. So we hope to make sure that they are followed nationally. So that's the good news from Washington, D.C.